and welcome to In the Know. We've all had that feeling of bloating and uneasy gas pains after eating something that doesn't sit well with us. Some of us brush it off and think not much of it, but the stomach is a complicated system. Understanding what happens in the digestive tract can help combat these issues. On today's show, Holistic Nutritionist Rita Mustafa will talk about the digestive tract and what goes on inside our stomachs. And she'll share some tips on how to control your bloating and stomach issues. Welcome to the show, Rita.
Thanks, Emily.
Okay, so break it down for me. What is the digestive tract?
So the digestive system is made up of something called the digestive tract, which is basically a group of hollow organs that are all linked together in this long, twisting system. And basically it starts at the mouth, ends at the anus. And so this digestive tract is part of our digestive system. And so when we talk about digestion, we have to think about digestion starting in the mouth.
Okay.
Right? So in the mouth, we begin to chew our food, and that's obviously going to start to break down our food. But then the mouth also starts to secrete saliva. And in the saliva, there's something called an enzyme, and you're going to hear me use this word a lot.
Enzyme.
Enzyme is basically a catalyst. It helps us to break down our food. So specifically in the mouth, the saliva contains this enzyme that helps us to break down carbohydrates. So as we chew our food, we're going to swallow our food, obviously, and it's going to go down this long, stretchy pipe called the esophagus. And the esophagus is made up of this tube with a muscular wall that's going to help squeeze our food down into the stomach. So that's the next part of the digestive tract, is the stomach. So if we think of the stomach is like, the best way to describe it, it's like a muscular, stretchy sack. And basically it's going to receive food. And then, I'm going to talk about this a little later, but it actually secretes different things, enzymes again, basically mush up our food for us, and then that takes us to the small intestine. So food will then travel to the small intestine, and the small intestine isn't actually that small. It's about 22 feet in length. So it's quite a long system, but the small intestine is very important because that's where digestion is still going to occur, but also where our minerals and our nutrients are going to be absorbed.
And how about the large intestine, Rita?
And the large intestine is the next section of the digestive tract. So once food leaves the small intestine, it enters the large intestine, and at this point it's really waste product. So it's no longer food that's going to be digested. It's basically undigestible food, maybe fiber, water, that type of thing. And basically that's the digestive tract.
Now, another important part of the digestive system that I've heard about is the pancreas.
Right.
Is that the most important part, would you say, or just one of many important parts?
So when we talk about digestive system, the pancreas, the gallbladder, the liver, those all play a part in helping us digest our food, but it is part of the digestive system. So the pancreas, if you want to think of the pancreas as this long, spongy organ, it actually sits in behind the stomach, and the stomach is just on your left side under the rib cage. And the pancreas is what produces digestive enzymes, so enzymes again. So these enzymes are going to help us break down carbohydrates, they're going to help us break down proteins and fats. And then to help with digestion also is the gallbladder. And the gallbladder is this little pear-shaped organ. It's attached to the liver, and it stores bile. And the liver makes the bile, which gets stored in the gallbladder, and the gallbladder delivers basically the bile into the small intestine, again, to help us with digestion. And then, of course, there's the liver. The liver is our largest internal organ, and it's going to receive blood flow from the digestive system, and it's going to help detox what's coming through. It's going to help absorb nutrients, deliver nutrients to the rest of the body wherever it needs to go. So that's really the digestive system.
That's a lot of different components, a lot of different parts.
Yeah.
But throughout the hour, you're going to break it down for us and explain to us why each of those, components are important, right?
That's
and
right.
how we can get our nutrients from foods and to benefit those different parts.
Absolutely.
So my question is, why do people have so many stomach issues? I mean, you just hear it over and over again. You eat something, I feel bloated, I don't feel well. Why is that so common?
Well, it really depends on a number of things. So some people may be eating foods that they're allergic or sensitive to or just don't tolerate. And so you know, the digestive system is going to react to that by giving us signs like gas and bloating. For some people, it's, you know, maybe they've been on medications for long periods of time, and that sort of weakened their digestive system, and now they're, you know, reacting to different foods and things like that. For some people, it may even just be poor eating habits. Maybe just, you know, eating fast food, eating a lot of sugary foods, you know, that type of thing. So there's many reasons why people are going to feel gassy, bloated, heartburn, all that type of stuff after they eat.
So Rita, is there a solution to all these issues? Is there a way that we, you know, ourselves in our day-to-day can control that?
Well, obviously proper eating, better eating habits, I should say. You know, getting tested for food sensitivities, allergies, things like that. Incorporating more raw foods into the diet. The raw foods are so rich in enzymes, and so, you know, they just help the body. The body basically processes that food better because it doesn't necessarily require all those other organs to kind of work so hard.
Can we talk a little bit about that? You brought some raw foods here. Why are raw foods so important when it comes to the digestive system?
So raw foods, again, they're rich in these digestive enzymes. Once we start to cook our food, we start to lose the enzymes, the stuff that helps break down the food in the first place.
Okay.
And so, you know, I like to encourage my clients to incorporate some raw food into every meal. So, you know, with breakfast, you can have your oatmeal, which is cooked, but have some raw nuts and seeds, or have an apple, or have a banana.
So just mix it in there.
Right.
What do those raw nuts do, or that raw food? How does it help your stomach and your digestive system? So
they all have different properties. Some are going to be richer in fiber than others. Some are going to contain, you know, healthy fats like our omega-3s. So all of them are going to play a different role. Having whole grains is going to be really important because it slows down the rate of, not only the rate of digestion, but the rate at which insulin gets released, and it helps to keep our blood sugar levels more stable throughout the day, and, you know, we're not getting that sugar rush and then that drop in energy throughout the day.
So people who are trying to understand their, you know, their stomach, their digestive system for the first time, what's the first thing you can recommend to them starting out?
I would recommend eating more whole grains, whole foods, basically. So less packaged stuff, less processed stuff. Drink your water, get some raw foods in. It's not that difficult. You know, once you start looking at just the little components that the body needs, it's basically water and good food.
And I've heard time and time again, stick to the colorful foods. Make your plate a rainbow.
A rainbow, that's right. Because all of the different colors are going to provide us with different nutrients.
Wow. Okay, so like I said, throughout the hour, we're going to break down the digestive system, talk about each component, and talk more about the wonderful raw foods you can have.
That's right.
Okay, stay tuned. After the break, we're talking about the digestive system. Welcome back to the show. We're talking all about the digestive system. Now, Rita, we talked about all the different components, but the stomach is pretty important, right?
So the stomach is an area where you know, clients come in with a lot of complaints. And so again, just to talk about the stomach a little bit, the stomach is this, think of it as a stretchy muscular sac, and it actually sits underneath the rib cage on the left side. So a lot of people think it's right in the center, but it's more off to the side.
And that's where you get those stomach stitches sometimes and those cramps, right? When you're overeating.
So the stomach, so basically its job is to receive food. So we chew our food, we swallow it, it'll eventually go down the esophagus into the stomach. And the stomach, the wall of the stomach, actually produces different things. So one of the things it produces is enzyme, again, so a different type of enzyme that helps us break down our proteins. It also produces something called hydrochloric acid. And so together, the hydrochloric acid and the enzymes, it will basically send a message to the stomach to start mushing up our food, basically, right? Yeah. So this is again, where digestion is going to happen.
But is that the first step that people experience, kind of that pain and the uneasiness and the gas pains? Is that where it actually occurs, in the stomach?
It can, because that hydrochloric acid is a really important part of the stomach. So the stomach is actually a very acidic environment. It's meant to be a very acidic environment because that hydrochloric acid is what helps to start to dissolve the food, if you will. And the hydrochloric acid also, it helps to stimulate other things. So it basically stimulates the pepsin, which starts to break down our protein now.
Okay.
And it also is really important because it helps to kill off microorganisms in our food. So when we eat,
a lot of different jobs there.
That's right.
Yeah.
So it's going to break down, or it's going to kill off, hopefully, the bacteria and the viruses and the yeast and parasites or whatever else might be in our food. So hydrochloric acid is very, very important in terms of digestion. And the reason why that's really important is because most people, especially adults, we tend to lose the ability to make as much hydrochloric acid as we did as we were younger. And so the less hydrochloric acid you make, the more heartburn type symptoms you start to feel, the more gas and bloating and belching type symptoms that you get. So it's really about that hydrochloric acid. Do we have enough, or is there too much? What's going on in that?
So is there a way to control that as you get older? Is it just in your diet? You can control, how much of those enzymes and acids are in your stomach and, kind of decrease the irritability that way?
You can. If you kind of start to pay attention to what the body's telling you. So if you start to notice, after a meal, within an hour or two, you're starting to get heartburn, then that's your sign that your stomach no longer is making as much hydrochloric acid as the body needs. So if heartburn is one of the issues, let's say, or even gas and bloating, but if it tends to start after a meal, within an hour or so after a meal, that's a signal. Your body's actually telling you, I'm not making enough hydrochloric acid, and so I'm just going to let the food sit here, and it's going to take that much longer now to digest this food. And so it sits there and it ferments and it causes this acidity in the stomach, and that's what people start to feel, is that food sitting there, that acid, the heartburn, the belching.
So what is heartburn exactly? How do you know if you have it?
Heartburn, it's more of a sensation. So it almost feels like, it just feels like pressure for some people. It can actually feel like some people might actually get reflux, where the heartburn is actually now traveling back up into the esophagus, and it's maybe giving them a sour taste in their mouth.
Right in their throat, in their mouth?
Absolutely.
Wow.
So those are all signs of, that we should be looking at the stomach and how much hydrochloric acid is your body making or not making.
So how can we prevent that from happening? And we have some products here on the table.
So number one is basically, how much food are you putting in? So it's always better to eat a lot of smaller meals as opposed to one or two just really huge meals, right? Especially if we have low stomach hydrochloric acid in our stomach, then people are definitely going to not feel that well because it's just too much food, not enough acid. So if you're eating smaller meals, that's going to be a lot easier for the body to handle, and so usually, we can cut back on the heartburn and the gas and bloating. But even if you do that and you find, I'm still getting heartburn, or I'm still getting whatever it is, belching, then we can start to do a few things. So one thing, apple cider vinegar. So apple cider vinegar, you can actually just mix a tablespoon or two in some water, and before a meal, you just actually drink it. And what this will start to do is it'll actually start to create this reaction in the body of this hydrochloric acid. So it's sort of a way to help stimulate that hydrochloric acid by drinking a little bit of apple cider vinegar.
But to me, apple cider vinegar sounds like it would be really sour and acidic. So,
which is what you want. It doesn't taste great, of course. It's not going to taste that great. So, but you don't need a lot of it. You just need a little bit in some water, and you're just going to drink it, 5-10 minutes before a meal, and that can help stimulate that hydrochloric acid that we need.
That's a great tip.
So that's just a simple home remedy that you can do. So, if you've tried it and you really just can't get past the taste
because it's a very distinct taste,
absolutely,
apple cider.
It's very sour.
Yeah.
Then you can do something like digestive enzymes. So you can go to your health food store, and you can ask for different kinds of digestive enzymes. If you are one of those people that gets heartburn 1 to 2 hours after a meal, then you want to find a digestive enzyme with hydrochloric acid in it.
So you can actually get these supplements or these digestive enzymes in a bottle?
In a bottle, that's right. So you can get it with hydrochloric acid, or you can get them without hydrochloric acid.
So how do you recommend taking it? Because I know, I've heard, you know, you should take it at least half an hour before you eat, so then it actually starts working and in your bloodstream. Is that true?
I don't know if you have to do it that soon before a meal. I've had people do it either before, during, or after. As long as you sort of get it into your system when the food is there, then it will help with that digestion process.
Oh, wow. So you really don't know if you're lacking some of those enzymes until you read your body, and it sounds like you know what foods you're compatible with and what foods are not compatible with.
That's right. So, again, if we go back to the belching or the burping or the heartburn, that type of thing, if you find taking a digestive enzyme with your meal sort of solves that problem, and that you feel great after you eat and you're not feeling any symptoms, then there's your solution. You probably were not making enough hydrochloric acid, and so that was your body telling you through the signs of heartburn and things like that.
And Rita, are you supposed to take this quite often? How many pills do you take, or do you suggest that they just read the bottle and the recommended dosage?
So you can follow. Usually I just have people start with just one capsule or tablet or whatever form they buy it in, and just take it with their meal. Some people might need to take 2 or 3, depending on how long they've gone without making hydrochloric acid and things like that. Some people need a lot. Some people might just need 1 and that's it. Some people, if they've forgotten to take an enzyme and they do get the heartburn an hour or so after, you can even take it at that point, and that will help get rid of the heartburn and digest your food.
And teas, obviously, teas are obviously important too when helping with stomach issues.
Right. So peppermint tea is really good with a meal or even after a meal, and you can drink it as a warm tea, or you can even drink it cold throughout the day. And that peppermint tea is very soothing for the stomach and even the intestinal tract.
Okay. Perfect. Thanks so much, Rita. We're talking all about the digestive tract. Stay tuned. Welcome back to the show. We're talking all about the digestive system. Now, Rita, tell me a little bit about the small intestine. Is that really important as well in the whole digestive tract?
So the small intestine is the next step in digestion, pretty much. So once the stomach is done doing what it needs to do with the food, it basically now sends it into the small intestine.
Oh, okay.
So the small intestine, again, is where digestion is going to continue to happen, but small intestine is really important because this is where the absorption of our nutrients happen. And so to help with that process, we need the help of enzymes again. So this is where the pancreas comes in, and the pancreas is going to send out more digestive enzymes, and these enzymes are going to be specific to breaking down carbohydrates, our proteins, and our fats. So and also we should say the gallbladder is going to be helping us at this point too, because the gallbladder, which is storing the bile that the liver made, actually also gets delivered to the small intestine, and that's where the bile is going to break down our fat molecules to even smaller fat molecules so that we can absorb them.
Okay.
Absorb them.
And I just wanted to briefly talk about different testing. I mean, there are different test kits you can get on your own to test if you're, what exactly are your stomach issues?
Exactly. So in my practice, I have different test kits depending on symptoms that people come in with.
So like allergy tests?
Right. So food allergy, food sensitivity testing is a really important test, because if you're eating the wrong foods, then obviously it's just going to put that much more pressure and work on your digestive system. And for some people, sensitivities can even cause damage to the intestinal tract, which can cause another host of problems. So food sensitivity issues, food sensitivity testing, I should say, is going to be really important if you're coming in with, digestive issues that just don't seem to want to go away.
So it's always, so you recommend to do these tests before you get into a certain diet, or?
You can do them at any time. I mean, some people like to start with just making some dietary changes, and if that's not sufficient enough to kind of help with their problems, then definitely I would recommend they spend the money and get testing done, because it does help in the long run, just to kind of, if you get rid of the foods that you're not supposed to eat, you'll just feel that much better.
Makes sense. So I heard that the most common causes of stomach issues can be dairy and wheat.
Right. So wheat and dairy are probably two of the most important foods that are going to really cause digestive issues in people. And dairy, number one, can be an issue mainly because basically as we're weaned from our mother's breast milk, we start to lose the ability to break down lactose. And lactose is a sugar that we find in dairy products. Oh, so as we age, that ability to produce enzymes that are going to break that down basically start to go away. So most adults don't have that ability to break down lactose. So,
and is that why many people are lactose intolerant?
Exactly. So, the symptoms are going to be gas, bloating, could be pain for some, could be diarrhea for others. So it's basically that, you just no longer make that enzyme to break down that lactose. So if it's just an intolerance, meaning, okay, you can't break down that sugar, then, there's different options. Of course, you can avoid dairy. That's always not so easy for people. So,
but if you can't stay away from
if you can't stay away and
dairy,
it's just an intolerance, it's not an allergy or sensitivity, then you can actually go to the health food store and ask for an enzyme that specifically will help with the breakdown of milk products.
Okay.
So you ask for a digestive enzyme that's going to help you with dairy, and for a lot of people that's pretty much all they need, and then they can have dairy products without any of the side effects, such as the bloating and the pain and the whatever else goes along with it.
And there are different dairy alternatives out there now. There's so many choices when you go into the grocery store.
That's right. So, if someone, let's say they get tested, or if they just decide they're just going to go off dairy because they just feel better when they don't do dairy products, they can do things like almond milk, hemp milk. I've seen rice milk. I've seen oat milk. So there's so many different alternatives on the shelf now that you shouldn't really feel deprived. You can still have your cereal in the morning and just use almond milk or rice milk or whatever milk that you like, coconut milk even.
And they actually taste pretty good.
Like, they do.
Taste really sweet. And sometimes I'm a little bit weary of drinking that because it tastes like there's a lot of sugar in it. Is that true? Like with the almond milk and the rice milk?
So you can buy them unsweetened. I prefer people buy unsweetened. If you're going to add sugar, add your own sugar. But some do come sweetened. Rice milk, something like rice milk actually is naturally a little bit sweeter than an almond milk, even without adding the extra sugar. So, if you're gonna switch to non-dairy product, you might have to play with them.
Yeah,
so you might have to try this one and try that one and see which one you like the best, and just go from there.
I find rice milk is it's lighter, but it still has the milky taste to it and the sweet taste. So it's, like you said, is rice milk the most natural out of all the dairy alternatives?
Rice and almond. I like rice and almond, but even hemp milk, it's got other properties too, like hemp seeds are high in omega-3, so you're getting some of the benefits of that. So they all have their benefits. Why not? You can always alternate them and just try the different ones and see what happens.
So Rita, can we talk a little bit about sugar? Because with stomach issues and bloating, should you stay away from sugar, or are there alternatives that you can go to?
Absolutely, there are alternatives. I would definitely, if someone's coming in with a lot of digestive issues, so gas, bloating, whatever it may be, even constipation, generally I have people stay away from refined sugars for sure. I mean, they serve no benefit to the body to begin with. So you can switch to things like agave syrup, which you have there, stevia, which is, it's actually an herb, so you don't actually need very much of it. So you can sweeten things up with stevia. You can use, I've got coconut sugar there at the front. And those sugars are actually what we call low glycemic, so they don't affect blood sugar levels to the effect that, let's say, a refined sugar would. So great for people who might have some blood sugar issues or might be hypoglycemic and you want to keep your blood sugar levels pretty stable, you can switch to alternatives.
Wow, because I mean something like coconut sugar sounds really, really sweet to me. So is that okay to go to if you're experiencing, you know, stomach issues?
Yeah, so switching to coconut sugar, it's not going to be any sweeter than white sugar, but it'll have a lot more benefits because it's the whole plant. Hasn't been refined. We haven't taken out minerals, that type of thing. So it's almost like a whole food in a way.
So why is the refined white sugar so bad for us? What is it about it that just doesn't, you know, sit well with us?
Refined sugar is pretty much exactly that. It's refined. It's down to one ingredient. All the benefits of whatever was in the cane to begin with to make cane sugar, all those things are gone. So the minerals and the vitamins that were with it, all those things are gone. And so now it's this concentrated, just one ingredient. It's very, very concentrated. And so it can almost act like a drug for some people. It can disrupt things like yeast in our body because yeast feeds off of sugar. So, you know, it can really just create havoc in the body. It decreases the immune system. So it has no benefit.
Okay, great tips. We're talking all about the digestive system. When we come back, we're talking more about the foods you can avoid and the foods that you can actually have when having stomach problems. Stay tuned. Welcome back to the show. We're talking all about the digestive system with holistic nutritionist Rita Mustafa. So Rita, tell me about probiotics.
Probiotics.
Yeah.
So probiotics are basically healthy bacteria, and basically the benefit of a probiotic is that we want to have good bacteria lining our intestinal system. When we talk about the large intestine actually has almost 700 different species of bacteria in it. So it's not that we don't want bacteria in our intestinal tract because it does serve a purpose. We just want to have a lot of good bacteria and so that it can crowd out the bad guys pretty much.
Okay, because that sounds kind of strange to me, having good bacteria. Recommended? I mean, how do you know if you have, you know, not enough good bacteria in your system?
Right. So again, going back to people's symptoms. So if someone has constipation or maybe they have you know, even gas and bloating. So if there's been some damage done to the intestinal tract because of medications or antibiotics or just poor diet, then you know, what happens is things start to escape out of the intestinal tract and into the bloodstream, and now we're starting to get allergic reactions to this, and now we're starting to get eczema, and now we're starting to get other conditions that have nothing to do with digestion, supposedly, like fibromyalgia and chronic fatigue and those types of things. So the good bacteria, we want to make sure that good bacteria is there so that it just keeps the bad bacteria under control.
Okay. So Rita, we actually have a caller on the line. Stacy from Markham has a question. Stacy?
Hi.
Hi, Stacy.
I was just wondering, the products that you showed before, are those effective on children as well?
The raw foods? Exactly.
Yes. And also the like the apple cider vinegar and those kind of products, are those like those enhance like the digestive system on children?
Okay, good question. Yeah,
So
when you're dealing with younger.
For children, it might be a little hard to get apple cider vinegar into them. You can try, but yeah. So if kids are having digestive issues, then it might be easier to do something like a chewable digestive enzyme. So you can get chewable digestive enzymes that taste minty. So it almost tastes like a candy.
Good, right? Okay, because it has to have a sweet flavor to it.
So it tastes more like a mint. So, you know, that might be a little bit easier to get into children. Probiotics, probiotics come in powder form. So if you have really, really small kids, you can actually put the probiotic powder into their water, their juice, whatever they may be drinking. And that's a really easy way to get that into kids. A lot of times capsules and things like that are going to be hard to do. So, you know, you want to try and find things that are more specific for kids. So like chewable type things or powder type type things.
Or you can always go to the raw foods, chop it up, mix it up, and they can get their nutrients that way.
Absolutely. You can hide things in applesauce, or you can do a lot of juicing or smoothies in the morning, and just you can hide so many things in a smoothie. Put some bananas in there. You can even hide spinach and seeds and fish oils and whatever else you want to hide in there. So smoothies are a really great way to hide things for kids.
Well, speaking of oil, this kind of caught my eye here. What exactly is this oil of oregano?
So oil of oregano, so we were talking about bacteria in the intestinal tract, right? So sometimes some people want something that's antibacterial but not necessarily want to do an antibiotic, let's say. So oil of oregano is a very powerful antibacterial, and it's usually mixed in with an oil because it's so hard to get in. All you need is a few drops of that, and you can actually smell the product through the box. It's that powerful.
So a little goes a long way?
Mm-hmm. It actually you just need a drop or two. So really great for anybody who's prone to even strep throats or sore throats, or beginning of a cold or a flu. You just take a drop, and again that can be a really powerful antibacterial.
So Rita, you don't need to mix this in with anything. Mix it with water. Is it good just to take it on its own?
I prefer to just get it over with. Just put a drop in your mouth and just swallow and get it over with. Some people, of course, it's going to be too strong, so you can mix it with water and sip it or drink it. And those who really can't tolerate it, you can actually even buy it in capsule form, in gel caps and things like that. So you just have to swallow it. But if we're dealing with sore throat stuff, it's more beneficial if you can actually just take it. Yeah.
So going back to the good bacteria and the probiotics, there's a lot of products like yogurt products that have probiotics.
Right.
But if you're trying to stay away from dairy and milk, how do you compromise there?
So exactly. So a lot of people believe they're going to do yogurts and that's how they're going to get their good healthy bacteria in the diet. But like you said, if milk is one of the reasons that you're coming into me with gas, bloating, and digestive issues, then yogurt's not going to be a very good way to get your probiotics in. So I'd probably have somebody supplement. Go to the health food store, get a good probiotic, something in the refrigerated section, and just supplement that way. That way you know exactly how much you're getting, and and you don't have to worry about the gas and bloating from the dairy product.
Yeah. So let's go back to the large intestine. We talked about it at the beginning of the segment. What else what other important factors are there in the large intestine?
So the large intestine basically is going to take leftover food from the small intestine. So the small intestine, it's digested the food, it's taken the nutrients that it needs, and now really what's left over is just waste product. And so once it enters the large intestine, it's going to enter in pretty much as undigestible food. It's going to enter fiber, water, bacteria, and that's going to travel through the intestinal tract. And this is where fiber is going to become really important, because with enough fiber we can get it'll just help with constipation issues and get the stool, the waste product, to go out of our system through elimination.
And some of the main products where you can get fiber, what can you
So fiber, if you're eating whole foods, whole grain type diet, you're getting more than enough fiber in your diet. Nuts and seeds, fresh vegetables, fresh fruits, those are all foods that are going to contain fiber. And we're going to talk about fiber in the next segment. But definitely, even talking about, remember we were talking about the bacteria in the large intestine. Right. There's some actually bacteria in the large intestine that actually make something called vitamin K. And so we do need some bacteria. This vitamin K is important because it helps with regulating blood clotting. It also helps with bone health. So, going back to good bacteria, you want to make sure you're getting a lot of the good bacteria, and so that, if the body needs to make vitamin K, it has the tools that it needs to do that.
Perfect. So we're talking about fiber, vitamins. It's all about the digestive system. Stay tuned. welcome back to the show. We're talking all about the digestive system, why we experience bloating and gas pains. So, Rita, there's a lot of alternatives and foods that we can go to stop some of these issues, right?
Mm-hmm. So I want to talk a little bit about fiber. So fiber
Yes,
is really
fiber's
important in terms of helping people out when it comes to digestive issues.
Mm-hmm.
So fiber in general is just basically going to help with proper digestive system. And so basically it has a number of roles. It's going to help normalize our bowel movements. You know, there's some fiber that's going to add bulk to our stool. There's some fiber that's actually going to act more like a stool softener and help stool to move through the bowels. So, you know, it's going to be important for anybody who's suffering with constipation, anybody who's suffering even with the opposite, with loose stool. Then it can, of course, help give you more of a formed stool, if you will.
So what are some of the specific fiber products that can help with that?
So
do we have
all
some
these
oats
foods here are
Okay.
pretty much foods that are going to contain fiber, whether it's soluble fiber or whether it's insoluble fiber. So thinking, look, you were mentioning the oats. So oats are really good because they contain fiber, of course, and fiber, including oats, can help actually people with cholesterol problems.
Oh, okay.
So it can
Wow.
bind to the extra cholesterol that's floating around and help you through elimination get rid of some of that extra cholesterol. So.
And how about these sprouted beans?
So the beans, any type of bean is going to be very rich in fiber. Also, you know, has great complex carbohydrates. It has some proteins. But these ones in particular are sprouted. So anytime anything is sprouted, it actually improves the nutritional value of that food, and it makes it easier for digestion.
So what does it mean by sprouted? Is it straight from the ground? Is it still processed differently?
No, sprouted just means we've taken the seed, we've actually, or whatever food it is, and we've soaked it until it's actually started to sprout. So we take that food, and when it gets to a certain point, then we stop the sprouting process, and then we either dry it, or we cook with it, or we eat it.
Okay, great. And of course, we keep on going back to the vegetables and the raw food. What are the main benefits of going this way?
So, of course, again, all these foods are going to contain fiber. Going back to eating your raw fruits and vegetables, you know, it's so easy to get your fiber in. You know, they recommend at least 25 grams of fiber a day. And if you're eating, you know, an apple here, a carrot there, a salad here, you know, nuts and seeds, it's so easy to get your fiber in. And so not only do they provide fiber, but they provide nutrients and vitamins and minerals, and here you're providing omega-3s and proteins.
So let's talk about nuts, because I find that's the easiest way to snack if you want to choose, I guess, a healthier snacking alternative. So what are the benefits of something like sunflower seeds?
So sunflower seeds, again, raw sunflower seeds, raw pumpkin seeds, those are going to contain healthy fats, which is going to be beneficial for our immune system, great for our skin. It's a raw food, so it's rich in enzymes. And of course, it has fiber, it has protein. So many benefits to eating nuts and seeds.
And pumpkin seeds, is that the same sort of thing? The same benefits here?
Yeah, pumpkin seeds actually tend to be high in zinc, so great for prostate. So in men, you know, start snacking on pumpkin seeds. It's easy to, you know, add to your salads or just use it as a snack throughout the day, sprinkle it on your cereal in the morning, however you like them. Yeah.
And I've heard good things about dates and prunes, even though they may not be the tastiest. What are the benefits there?
So same thing. So again, it's a whole food. It's going to provide us with enzymes. It's going to provide us with fiber. And they're easy enough, again, to throw into our cereals in the morning or throw into our smoothie or just snack. Like mix some dates or figs with raisins and nuts and seeds, and you've got a great snack, high in fiber, lots of nutrients, keeps our blood sugars from fluctuating. So really easy to incorporate into the diet, I think, anyways.
Now, are there any downfalls of having too much fiber? Can you really have too much of a good thing, or do you recommend controlling your fiber intake?
Fiber becomes an issue if you all of a sudden decide to start increasing your fiber intake and you don't increase your water intake. Because there's soluble fiber. Once soluble fiber gets into the intestinal tract, it actually absorbs water. So it needs water to become your stool softener, if you will. So if you just start, eating all this fiber-rich foods and you forget to add water, you're probably going to become more constipated and probably have more gas and more bloating. So it's really, really important to make sure that you're getting lots of water into the diet.
So what do you recommend on how many glasses of water you should have a day?
Basically, I tell people take your weight and half of it in ounces. So if you're 100 pounds, you want 50 ounces of water. So that's about 6 cups of water, right? So if you're 200 pounds, you're going to double that. You need about 12 glasses of water.
And like you just mentioned, if you have a rich fiber diet, you need to definitely be drinking lots of water.
You're drinking your water
throughout the day.
Yeah. And things like other fluids like coffees and things like that, that actually is going to require that you drink even more water. So, you know, it's important to make sure you're getting your water in and, you know, and maybe cutting back on things like coffee and things that's going to deplete minerals from your body.
Oh,
and
that's tough to,
I know,
to cut the
tough.
coffee out of
Most people
diet.
don't like to hear that, but at least, you know, drink more water.
And like we mentioned before in the other segment, tea is actually a really good alternative to
herbal teas. That's right. So herbal teas can help replace water. It can help replace teas throughout the day, coffee throughout the day, I mean.
And can you also get fiber from, I guess, the cans and in different powder form as well? Do you recommend that?
So some people, you know, maybe they don't eat maybe the best diet, or maybe they travel a lot and don't get, you know, enough fiber into their diet, then they can go to a health food store and get something like psyllium. Psyllium is probably one of the main, is actually the main ingredient in Metamucil, but you know, this is a little bit healthier because it doesn't have any of the you know, food coloring and artificial sweeteners.
Because a lot of people take Metamucil.
Absolutely.
So
yeah.
you don't recommend that? You recommend more of the raw form, the more natural form?
I prefer the more natural form because that's easy enough to kind of hide into your smoothies, put into your oatmeal in the morning, that type of thing.
Okay, perfect. So more tips and more helpful information about the digestive system. Stay tuned. Welcome back to the show. We're talking all about the digestive system. Now we have a caller on the line. Sonia from Bradford has a question. Sonia?
Hi, how are you?
Good. What's your question?
I have a question. I've been having, I had cancer about 8 years ago, and they did something wrong with my intestines. I was diagnosed with irritable bowel syndrome. And since then, anything that I eat, I've tried many, I went on Weight Watchers, I've tried so many, like, different diets. It's just, I'm always constipated. Like, I've tried the fiber, and it works the other way around. Like, I get worse and worse. Like, there's days I have to miss work. That's gotten to that bad situation.
So
is there anything that you recommend?
Okay, so number of things that could have happened. So when you go through cancer treatments, a lot of that medication can cause damage to the intestinal tract.
Yeah.
And so what's probably happened is over the years you've probably developed sensitivities to different foods. And so you know, you've probably developed allergies to maybe things like wheat and dairy and maybe some other foods that possibly could be contributing to the constipation issue. And so a lot of times when, you know, going to that fiber, of course, might cause more constipation because a lot of times people go out and buy fiber products that are made from wheat, right? So wheat bran and wheat buds.
Because she's experiencing the opposite. I mean, she's trying to do something good and then...
Right, so she's probably getting more constipated, which is, you know, again, if you're not drinking the water, that can cause it if you're doing extra fiber. But more likely than not, it's probably you've developed sensitivities to certain foods, and now your body's just reacting to that. And so I'd probably recommend getting some food sensitivity testing if you can, but definitely try avoiding some of those foods that tend to cause constipation, like wheat and dairy products, and it could even be things like soy products or corn. So there's so many different foods that can contribute to constipation. So I'd even try, if you haven't tried before, acupuncture. Acupuncture is a wonderful tool for digestive health.
Let's talk about that, Rita, because I mean, you specialize in that too.
Right.
What are the benefits of acupuncture? So
acupuncture is a great tool because basically what acupuncture is meant to do is just to balance the body. So wherever there's an imbalance, I basically need to find where the imbalance is and put needles in specific areas to help move that energy so that now the imbalance isn't there anymore.
Oh, okay. And is acupuncture for everybody? I mean, some people are scared about the tiny needles going into them. Do you sort of test out your clients beforehand to see if they react well to it?
I know acupuncture is scary. It's scarier than it really is, because most people, even I've had people come in that are afraid of needles and they don't want to see the needles go in. And you know what? For the most part, most people don't even feel the needles going in. And if you do feel them, it's like a mosquito bite. So if you can handle a mosquito bite, that's the worst feeling you'll feel. But otherwise, most people don't feel a thing.
So Rita, we have here a model of the human body. And are these the different acupuncture points that you
So all those
can
dots
refer to?
there are places where I can put an acupuncture needle.
Now it's all sort of in code word here, in
Yes.
different letters. But what are the main parts that you focus on when you're dealing with people who have irritable bowel syndrome?
So with any type of digestive issues, I'm going to be working on the large intestine meridians. I'm going to be working on the stomach meridian. I may work on the liver. So all those organs I talked about earlier, those are all different organs that I can stimulate to help improve digestion, get rid of gas, get rid of cramping. I can get rid of heartburn with acupuncture.
But how many sessions does it take to actually, feel a difference?
Depends on the person. For a lot of people, they'll actually notice a difference after just one visit.
Wow.
And you can come weekly if you find that it's that helpful. But once you've come for a while, you'll actually start to notice the body starts to learn how to act better, and so you won't need to be coming as often. But in the beginning, you might come a little more often than normal, like maybe once a week. But then after that, you can come monthly or whenever you need to.
And is acupuncture, though, recommended for people who have like severe stomach problems, or just people who have light issues?
Any type of problem.
Any type.
I've used acupuncture for many digestive issues, not even just digestive issues, any type of issues. So whether it be pain, cramping, whether it be spasms in the colon, whatever it may be, any type of issue can be treated pretty much with acupuncture.
So like we were talking about before in the other segments, coconut sugar, coconut oil is really good for you. And we have some here, a jar of coconut oil. What are the benefits there? So
coconut oil is really rich in a substance called caprylic acid. And we didn't talk too much about it, but candida. Candida is another problem that can affect the digestive system. So it can, cause constipation. It can cause gas and bloating, and so you can take coconut oil, and that can act as an antifungal for some people.
Wow.
Yeah.
Wow. And you actually wrote a book.
I did.
About and tell us about it.
So the cookbook is called Wheat-Free, Dairy-Free, and of course, going back to food sensitivities, which is what I focus on. Wheat and dairy are the two most common foods that cause problems in people. And so the cookbook is really meant for clients to help them on this new path where they're now trying to avoid wheat and dairy. Very simple recipes and very easy to follow.
And why did you want to put that together? I mean, were a lot of your clients, looking for alternatives to, wheat and dairy and where they can turn
alternatives
to?
And also a lot of people are lost because everything out there has wheat and dairy in it, and it's hard for people to kind of know what to buy, and maybe they not good at reading labels, that type of thing. So I really just put this together for my clients so that they can just take this home, make simple things like pancakes, or make soups or desserts, and not worry about having it affect their digestive system and cause them pain.
Okay, perfect. There's a lot of information there, but a lot of helpful information about your whole digestive system. Rita, I want to thank you for being on the show, sharing all your helpful tips. Thank you for watching, and we'll see you next week.